Well, good afternoon, Rochester. Welcome to the April Equity Series episode. My name is Wafa Al Khalifa, and I work for Destination Medical Center as the Equitable Development Manager. And I'm here with my colleague, Chow Matala, who serves City of Rochester as the Diversity, Equity, and Inclusion Director. We welcome you to another episode of the Equity Series where we hopefully provide you some new information that you can share back with your colleagues, with your communities. And I just want to remind everyone, let me see here if I could push where you could access our previous episodes. You will find all the episodes that we have presented to you all on the DMC YouTube channel. I've heard in the past some organizations use the Equity Series episodes as a professional development tool. They have watch parties with their staff, and we're really excited to hear that. And if you have other ways of how you are utilizing these episodes to share this knowledge and to spread it out in the community and with your organizations, please let us know and drop those comments in the chat. And if you or your organization is interested to learn more about the Equity Alliance or the equity efforts that Chow and I are leading within our organizations, Destination Medical Center or City of Rochester, or if you have any ideas about any topics that we should include in the upcoming month, please connect with Chow and I, and we'll be more than happy to connect with you. But for today's episode, I'm really excited to have some of my colleagues that I work closely with that they'll be sharing the topic that you see on the screen, which is when transportation choice expands, what becomes possible. And today we will have Lauren Jensen, who is the Energy and Sustainability Manager for DMC, along with Lauren, we will have Matt Lynch, and he's the Mode Shift Coordinator for City of Rochester. I welcome you both, and thank you so much for being with us today and to shed light on transportation through our equity series.
Thank you, Wafa. All right. And can I get a head nod from anybody that can confirm screens are live? Thank you very much. All right. So before we talk about problems or solutions, I do want to we want to ground this presentation in adopted direction. So this presentation is not proposing an entirely new path. It builds on existing goals and plans already adopted by the City of Rochester, Destination Medical Center, and regional partners. And at the same time, I want to be clear that continuing to design a system where driving remains the only realistic option, it has real consequences. And so our goal here today is to describe how those options provide different ways of access to transportation modes. And I want to acknowledge too that driving remains an important option. And our goal is to talk about how expanding practical options can better support equity, access, health, and community well-being more broadly. So with that, to get us thinking in human terms, not technical terms, we'd like to ask you to think about a trip that you took recently. Maybe it was to work, maybe to school, to drop off or pick up a childcare, an appointment shopping, or maybe somewhere for recreation, because that's important too. What would have made that trip better? Faster, perhaps, less stressful, safer, healthier, cheaper, more accessible, or even better for the environment? And I'd love to hear a couple of answers in the chat if you would. Please feel free to add your additions there. And the reason we start here is that transportation choice is not only a mobility issue, it is also a safety, health, equity, and environmental issue. So in here, you'll see that mode shift is the goal we want to see in the future, and transportation demand management is how we make it easier to choose. The goals that we have exhibited on the left side of the screen show the mode share, what is existing when the study was taken in, I believe it was 2018, and then also where we want to be in 2035 and even 2040. So mode shift is what we want to see, all those different changes in how people choose to get around. But then demand management, or abbreviated as TDM, is how we make it easier to choose. That's with our tool set, our different ways we can actually offer infrastructure, space to move safely, comfortably, conveniently in a connected way. So that's the two different terms that we just wanted to define up front for you all. All right, and with that, I'll hand it over to Lauren.
Thanks, Matt. So this image is just kind of to get us started, help us illustrate why mode shift matters in a very practical way. The point isn't that one mode is good or another mode is bad, but just that there are different ways of moving people and using that space differently. So when more trips can happen by transit or walking, rolling, or biking, or even shared modes, the same amount of street space can move more people with less strain on the system overall. And that matters in a growing city, especially like places like downtown Rochester, where street space and parking spaces are limited. It also helps explain why transportation choice benefits everyone, including people who continue to drive. When others have practical alternatives, there's less competition for the same finite space. And we'll share some examples of what this looks like throughout the presentation here. Um, in the previous slide, Matt touched on the differences of mode shift and transportation demand management, or TDM. And so this is just, it can sound abstract, but this slide is just to help maybe make it a little more concrete. TDM can include employer transit benefits. So maybe you get free bus passes to commute to work. Maybe there are carpool incentives, like closer parking spaces, wayfinding, end of trip facilities like secured bike parking or lockers and showers that are available, flexible working hours like hybrid working arrangements, many of these different things. And what that helps do is just keep short trips viable year round. The point is TDM isn't one particular project. It's a coordinated set of all of these tools that help the system work better and make other options more visible and practical.
And one offering too is that a lot of these things that Lauren already referenced are happening in Rochester, whether it be in employers' realm or in the public sector. We're determining what are these support structures that can really present these options to be viable and connected and convenient and safe for users who want to choose those modes.
So why does TDM matter? The next chunk of our presentation here is going to kind of walk through what transportation options or lack thereof and the impact they have on our community. So it moves beyond just transportation alone, but how they impact household finances, access to opportunity like jobs, individual health, as well as environmental health. When households have to rely on owning, insuring, fueling, and maintaining multiple vehicles just to meet their everyday needs, that creates real pressure. And not everyone can drive because of age, disability, income, or life circumstance. But jobs, education, healthcare, and all of our daily needs still have to be reached, and there still needs to be options for people to do that. So that is why this conversation is really about who bears the cost and burden and who has access to opportunity through transportation. So this starting with kind of the economics and the financial perspective from individual households, this is just looking at, we'll kind of go through three levels in terms of what for households, transportation is one of the biggest reoccurring expenses, second only to housing for most families. For employers, commuting burden, parking costs, and employee stress can affect recruitment, retention, and day-to-day reliability. And for cities, roads and parking are expensive to build. They're expensive to maintain, especially with our weather patterns here in Minnesota, and they're expensive to expand. So TDM really helps manage demand rather than endlessly expanding the supply that we have available. It's one way to support affordability and reduce the pressure on household budgets and make a more productive use of limited public and private space. Next slide. So starting with the household, this is just kind of looking at household car ownership, and what that looks like in Rochester comparatively to the rest of the United States. In Rochester, most households often have two cars compared with the national pattern. We tend to have a little bit more vehicles. That may reflect a preference for some, but can also just reflect a practical need that's created when other options aren't as easy or direct or reliable for people. So, a helpful question in looking at this is, does vehicle ownership always represent free choice or sometimes the cost of having too few viable alternatives? And the next slide here is just going to kind of touch on that a little bit. Even though on average, more households in Rochester own two or more cars. That might not be the case for everyone in Rochester. And so, what this map is just briefly showing using some Esri MRI Simmons data. The main takeaway is that it's not vehicle ownership isn't high across most of this study area in downtown, which helps explain a car dependent baseline. So, access is not always universal. And even when households have a vehicle, that does not mean that every trip should have to depend on using that vehicle. So that's why transportation choice still matters. Continuing with the economic impact on individual households, the annual cost of owning a car can come out to around $12,000 a year or about $1,000 a month. This is budgeting for unexpected repairs and fuel and maintenance costs, and is also looking at the average cost of a new vehicle being around $39,000. But even if it was a used vehicle, and let's say you cut that amount in half and it was $6,000 a year, it's still considerably more expensive on a household budget to own and plan and budget for a vehicle than it is to be able to walk to your work or the services you need each day. That's free. Biking, if you include the cost of biking and maintenance, and maybe paying for secured parking is around $1,000 a year. And transit, depending on your age or income class, can be anywhere between $200 and $480 here in Rochester a year for a transit pass. So, not every trip should happen without a car, but the point is when more trips can happen another way, households gain some breathability and flexibility.
And one thing I'll add too is these calculations were based on AAA's projections, and what it does skew, and I want to clarify, is that it does offer that it's for a newer car. This would be a cost for a newer car. So if someone's driving perhaps a 20-year-old very reliable vehicle, it doesn't necessarily mean that that's what they are paying, but this is what a newer car could cost a household to own and operate the vehicle.
And then from a city perspective, land use and what we do with it also has impacts. So Rochester is expected to grow in jobs and population. And to keep up with that growth and the current demand that we have for parking downtown would require 7 additional city blocks of parking ramps to meet that demand that with the growth. The average cost of a parking ramp is around $22,000 per space. So building each of those parking ramps would cost anywhere around $51 million per ramp to build. And then you also have the maintenance costs of parking ramps, which is anywhere around $850,000 per year on maintenance costs. And that's just downtown. This also impacts individual single family homes. The median cost of construction for the garage and driveway adds about $22,000 it's about 20% of the cost to build a home. So it also increases rents when we are including parking in multifamily buildings as well. So it increases rents approximately 15%, even though 20% of occupants in multifamily buildings don't own a car. So it increases affordability, it reduces pressure on households' budgets, and it makes a more productive use of limited space, both public and private, when we consider alternative options and don't always focus on parking supply for cars. going into the next slide, this is just an example of what that also means from a city perspective. When we have parking ramps or parking lots, it's a less activated and vibrant use of that space for our downtown area. The tax capacity is also significantly lower on a parking lot than it is for something like One Discovery Square, which is a mixed use office and lab building space. That brings in over $162,000 in tax capacity. Or something like the multifamily project, the Berkman, down by St. Mary's, brings in over $16 million in tax capacity. So that impacts what our city is able to do and the services it's able to provide to residents when we are also increasing our tax capacity, depending on what we're putting and how we're using our land.
And not just for tax capacity, but speaking from personal experience, I'll say that the Berkman and Discovery Square properties are places that I want to be. I want to actually be in and around, where what it was in 2014, I don't necessarily need to like linger and spend time and money there, perhaps. So just some consideration for that lived experience.
And then lastly, just kind of continuing on the financial impacts from a city perspective. As I touched on earlier, it costs money to build roads, to continue to maintain that investment. And again, if we are looking at comparative patterns, the image map on the left there is looking at West Circle Drive and the area surrounding that. That's 108 miles of roads that needs to be maintained on an annual basis. And the tax value of that is of $1 billion versus this snippet of downtown in the DMC district. It's 42 miles of road, well-connected network in that road, and that is equal to $1 billion in value. So it costs us more to maintain and continue to sprawl and build new roads. And again, it doesn't bring in what it takes to maintain those roads. Next slide. So looking at moving from financially how it impacts individuals and households and employers to the health impacts of transportation options as well. On average, folks in Rochester spend about 17 minutes in their commute in a car. That's twice a day. So think of what the alternatives could be if you weren't in a car and what you could use that time for. And really, this is just looking at a city built for health should move differently and have options to move differently. Transportation systems shape our daily physical activity that impacts our stress levels, our overall safety in our community, and our air quality. Traffic injuries and fatalities are not inevitable. They're influenced by design and policy choices. Shorter trips are the most likely to become walking or rolling if the route is safe and comfortable and obstacle-free. And especially in a city where health is central to our identity, the way people move through the city should support health rather than work against it. So by providing these alternative transportation options and pedestrian or bicycle facilities, we can really create opportunities for people to exercise recreationally and build that into their daily routine. Transit isn't typically thought as a form of active transportation, but even when you are using public transit, people are walking to and from those transit stops and getting in more steps in their day than they would in a car. So investing in transit, bicycle, pedestrian facilities not only creates opportunities for people to exercise, but that in turn also has other health impacts like reducing obesity and the risks of other associated diseases and conditions such as diabetes or cardiovascular disease and premature death. So the investments are particularly important in low-income communities and communities of color, where residents are likely to own vehicles, but maybe don't have adequate facilities that pose a barrier to using active transportation. And we'll touch on that in the next slide here as well. Sustainability and climate. There are also transportation impacts and the options that we have here as well. And really kind of is the culmination of a lot of these things. So transportation is the leading source of emissions, but it's not only a climate conversation. More cars mean more congestion, more space consumption, more infrastructure cost, and more local pollution from exhaust, brake dust, tire debris, and runoff from vehicles. A recent review of automobility argues that crash risk, population exposure, land use impacts, and inequitable access are all interconnected. And what this slide is trying to do is to show those interconnections. So the image on the top is a map outlining the 4 environmental justice census tracts that are in Rochester. The red lines show Highway 63, that is moving north-south, and then Highway 14 that kind of cuts across from east-west in Rochester. So you can see the intersection of those environmental justice census tracts with these major highways or roadways that were developed. And then the image below is from our tree plotter canopy tool that the city has that is looking at the intersection of populations that are below poverty, populations that are vulnerable in any way, and then where there is low existing tree canopy. And the blue lines there are representing those same roadways and highways. So where we see lower investment in neighborhoods because of historic practices like redlining or highway projects, that has led to disproportionate climate impacts as well as health impacts for the people living in those communities. So lower tree canopy, it means increased urban island effects. The frequency and volume of cars moving through the area contributes to air quality and pollution in those areas. So really, car-centric infrastructure is a culmination of a lot of these things that we're seeing. So what has impacted our transportation options today? Briefly touched on that, but historic and previous land use and policy choices have really prioritized sprawling single-family housing developments, especially in Rochester, where we are surrounded by cornfields. Earlier on and historically, it was very easy to just continue to grow and expand outward instead of upward. It prioritized big box stores and office parks, as well as parking for these areas. And again, that disproportionately affects marginalized communities. Over time, we've created this feedback loop between land use and transportation that has reinforced this automobile dominance. So this shows that, communities of color, lower income households, people with disabilities, older adults, and young people are more likely to bear the harms when driving is the default or the only option. The encouraging part, though, is that if policy choices helped create this pattern, policy choices can help create more practical and equitable options as well. Next slide, please. I'll hand it back over to Matt.
So to look at how we might be progressing, I'll just state that progress is mixed. Rochester still very much relies heavily on driving, and with driving alone trips remaining the dominant commute pattern that you see in the yellow line at the very top. It looks like it might be along the top y-axis, but it's actually, that is a line that just shows a very flat pattern. It has decreased slightly. And that is one of 2 statistics we can take confidently from the American Community Survey from the Census Bureau, is that driving alone remains a dominant commute pattern. And as you can see in 2019, the remote work line has gone up slightly. And those are the 2 statistics we can confidently take from the American Community Survey. And so the takeaway is not to overclaim precision in this, but just simply to recognize that other options still have significant room to grow. The reason that we can't definitively say that these others are genuine statistics are that the margin of error in such a such a small subset or survey being taken, those margins of errors are too great to really take statistics from. So we just say that to recognize that options still have significant room to grow, and so long as they're useful, connected, and reliable. And we also hear consistently that people want more practical choices beyond driving. We heard that consistently in the active transportation planning process and the transit development plan at the city. So the question is not whether there is interest, the question is, does the system actually support that interest well enough for people to act on it and make those choices? So the framing that we want to offer is simple. It's the freedom to not have to drive for every trip. And that does not mean that everyone will stop driving, and it does not suggest that driving is wrong. It means that people should have another realistic option when transit, walking, rolling, cycling, or sharing a trip, perhaps like carpooling, could work. So for many households, complete car dependence is expensive. It's stressful and it can be limiting. And the goal is not a theoretical choice, it's a practical choice. And so if transit is difficult to reach or difficult to understand or access, or there are barriers to actually getting to the stop to board the transit, then for many people, it's not truly an option. So what we'd like to also share is some important context around the the policy we're discussing, because policy exists today. The comprehensive plan has been adopted. It is the foundational plan for all city plans. And you can see it at the bottom there, it's foundational. And then we have city functional plans that are referenced all above. The comprehensive plan, transit development plan, the active transportation plan, our metropolitan transportation plan from ROCOG, the MPO, which is a metropolitan planning organization, and the Destination Medical Center plan work all, it all points toward a more integrated transportation system with realistic options and stronger access. So the question is not whether transit or multimodal access should be a part of Rochester's future. It is the question about how to implement that future in a coordinated, practical way, because we know these options are needed. It can maintain access for people already using the system by driving and parking, because all the people that want those options, the more they do that, it makes the system as a whole more efficient. So these adopted examples of the comprehensive plan goals matter because they already call for a more comprehensive transportation system with safe, attractive, and affordable choices for people of all ages and abilities. And they support transit as a viable choice and encourage shared mobility, and a call for policies and programs that help achieve mode shift goals, what we covered at the beginning of the presentation. So in other words, we're not discussing anything outside of Rochester's adopted direction. This is all part of carrying that direction forward and into implementation. So this may be the most important slide in the presentation, because transit and other mobility options do not work well as fragments. We often refer to the transportation network as a network because you need those connections for it to work. Sidewalks, crossings, shelters, stop access, multimodal connections, the information of when transit service might be arriving to service the population, frequency and reliability, they all have to work together as a system. And if any of those pieces breaks down, the trip becomes harder and less appealing. And perhaps individuals who would make different choices, they might resort to the default. So availability alone is not the same as usability. And when we talk about equitable access, we should be talking about the conditions around a trip, not just the existence of a route or a facility. So the next few maps that we'll share have modeled replica trip data. And this is a planning tool. It's not a direct count of individuals taking trips, so it should not be used with judgment alongside operations, safety, or design context. And the first map I'm showing you here shows where motorized access and circulation are concentrated today in and around downtown. And that matters because downtown Rochester have real vehicle needs, including patients, visitors, freight, service, and pickup and drop-off activity. And the goal is not to deny that reality. The goal is to understand where vehicle access will continue to matter and where some trips might be better served by transit and connected low-stress multimodal network. I also want to be clear that this is not recreational data that you'll be seeing, but is for all trips at a random Thursday in second quarter of 2025. So I'm going to skip forward to, here, I'll go back. So the maps you'll see following are going to show some of the trips that could be absorbed by walking trips. So this first walking and rolling trip. So this map shows short trips that may be feasible by walking or rolling within about 20 minutes. And I'd like to frame this as a first and last mile map. Perhaps many transit trips succeed or fail not because the bus ride itself, but because of the trip to and from the stop. So these short trips point us toward crossings, sidewalks, excuse me, sorry, getting my slides all mixed up, uh, uh, points us towards these crossings and sidewalks, curb ramps, different comfort levels, winter reliability, and direct pedestrian routes. So some of the strongest opportunities to support transit may simply be making it easier and safer for people to walk or roll to where transit already exists. And that's, again, through making those connections for a network rather than fragments. And so this next map looks at trips that may be feasible within a 20-minute bicycle ride. And so it does not mean that every short trip needs to shift to cycling. It does show where bicycling and micromobility may become more realistic if the network is connected, direct, and comfortable. And so this matters because bicycling and e-bikes, micromobility devices like e-scooters can extend the reach of transit beyond a comfortable walking distance or rolling distance and help more people access stops and destinations. So it also reminds us that cities should plan around the total access, not just commute access, because we know from a Brookings Institute study that reinforces the broader point that cities should plan around total access uh, because most of the trips taken across the country are actually for general trips, not commutes. So we plan a lot around commuting, but the vast majority of trips are not commutes. So in Rochester, people travel not only for work, but also for appointments, errands, school and meals, and also just daily life. So the work that we're already doing, what's happening now, it's not abstract. Like we mentioned earlier, things are already happening. There are public investments like in Link BRT, the bus rapid transit line. We have investment in Discovery Walk, and there are corridor and public realm improvements that are part of it. So are policy updates, private development expectations, and employer-focused TDM work and programs. So we're refining also our shared micromobility operations and coordinating parking access and policy and infrastructure so that the system as a whole works better. And so the common thread that you're hearing in the word, you probably heard multiple times now, is coordination. And that's aligning the public investment, the employer practices, the operations, and the land use so that transportation choice becomes easier to use in daily life.
So, to kind of summarize everything we've talked about today, driving is not always an option. And just to share a little bit of statistics locally here in Rochester, there are over 24,000 community members who are under the age of 15 and legally cannot drive. There's about just under 20,000 community members who are over the age of 65, maybe don't feel comfortable or safe driving anymore. There's 15,700 community members living with a disability, and around 10,200 community members living below the poverty line. So not everyone can drive because of a multitude of life circumstances, and life circumstances can change quickly due to temporary injury, needing to provide caregiving, job loss, or your own health changes. So when transportation systems only work for drivers, access to opportunity becomes uneven for the community. Short trips shouldn't require owning and operating a motor vehicle. Sometimes this is about infrastructure, and sometimes it's about policy or operations, including maintenance decisions that quietly determine whether a trip is even possible. Kind of touching on Matt's previous comment on the overall trip itself and not just the fact that the option for the trip exists. So transportation equity really means creating a system that works for people as they actually are, not only for ideal users. Equity means mobility that works for everyone and their own circumstances. And if we build a transportation system that works for everyone from the onset, we'll be in a much better position overall. Next slide, please. So really, this is about expanding options for real people. A system that works for ideal users is not a successful system. Transportation choice matters because the impacts of a drive-first system extend beyond mobility. And as we've touched on today, it shows up in safety, health, social inequity, and environmental burdens to our community. So we have to design for all of these people of our community, and the people who do not have the easiest access to a car. A simple test is, can someone who cannot drive make an everyday trip safely and comfortably without a car? If the answer is no, then the system is incomplete and we still have work to do. So, to bring it together and wrap it all up, transportation, the case for transportation choice is not one dimensional. It's economic, it's equitable, it's health related, and it's environmental. And that's why we're having this conversation here today. The same system choice that affects how people get around can also affect who has access, who bears the cost, and who experiences stress and risk, and what kind of community we're building overall. Overall, having choice creates a resilient and inclusive community.
So the simplest takeaway we'd like for you all to have is that choice benefits everyone. And this is not about telling people they cannot drive. Driving will, like I've said, it remains an important choice for many trips and many people. I'll acknowledge I often drive. I have 3 children who cannot get around by themselves. And so I am often moving them around, and doing so with a motor vehicle, it makes the most sense for some of our trips as a family. But when more people have practical options for the trips where other modes can work, the whole system functions better. Streets feel less strained, parking demand is less intense, and more people can reach daily life in ways that fit their circumstances. And that is why transportation choice is not a niche issue. It is a broader community benefit, and it's including people who still need and want to drive.
And before we open it up for Q&A, one last little reflection and call to action for those on the call today. Um, the key takeaway here is not everyone needs to be a transportation expert, but employers, educators, public agencies, and community leaders can all help identify where transportation barriers are affecting real people. And this includes understanding how your staff or your students or your patients or your clients get around, where that access breaks down, and whether benefits and information are visible, and what kinds of practical support would make a difference. Behavior change is hard, and so it is learning to make these other forms of transportation, not learning, it is making these other forms of transportation the easier choice for people. So we invite you all to consider how transportation options might impact your workforce or your organization, what needs transportation businesses fill, and do the current options meet our needs locally? And we have a really short survey if you're interested and would like to share your thoughts with us. We are beginning this work, and so we're curious what people's needs and barriers are so that we can continue to work together collaboratively with partners here in Rochester to provide more transportation options. Thank you all. So with that, I think our next slide is just opening it up for questions. And I know there's a couple in the chat that we can address.
Yep. Thank you so much, Lauren. Thank you so much, Matt, for this amazing presentation. We'll make sure that we'll share it with the audience and send a follow-up email along with the survey, the QR code for the survey. I really appreciate this presentation, and I wrote some notes as you were going through it because it is really interesting how a lot of the issues that we could be facing in today can be traced back to racist practices that occur, and seeing how you showed us the redlining map versus the impacts on the environment. Redlining occurred back what in the 1930s, where it created, named or labeled communities that they are, where Black communities, immigrant communities, um, labeled them as high risk. And then when you think about the 1950s and the 1960s, where the rise of highways and seeing more highways being built, and how these highways were created through red line communities and created displacement and disruption for the neighborhoods. But at the same time, it created also wealthier, um, often white households that moved to the suburbs. And then how driving, it did not it became like it became the only choice for people. So from redlining to building highways and continuing segregation, driving became the only choice and a necessity for people to be able to move around. And this work that you're leading and Matt is leading into how can we bring forward more options instead of just driving. I find this work is extremely interesting and it's a reminder for all of us that racism does lead into environmental impacts. It leads into negative sustainability impacts, and it leads into many impacts that maybe we're not seeing it today, and we will see it maybe in 100 years later as we're experiencing that today. So I thank you both so much for this presentation. And I want to go to the chat and to read some of the comments and the questions that we have received. I also want to invite everyone, if you want to open your camera, if you want to ask questions to Matt and Lauren to do so. There was a question that we received from Andrea, and the question is that I would like or interested to see Rochester as compared with the rest of the Midwest. Do you have any data or any information on comparing Rochester to the rest of the Midwest?
And I just like to ask a clarification, if I may, the comparison in regard to mode shift, perhaps, or mode split of how people are getting around.
Yep.
So we have, we are at a stage in the city of Rochester where we have several before us who have figured their mode shift targets, which are measured on a different basis than trips and commutes like we have. So the percentage changes that we are measuring are different than that of what perhaps Minneapolis, St. Paul, Madison, there was another one off the top of my head, Ames, or maybe it was Des Moines, about
Hmm.
how they measure in terms of vehicle miles traveled, while ours are measured in trips. So that is a difference, and so it'd be apples to oranges, but we can see, and actually in that ACS, the American Community Survey data, there are comparisons to those cities' commutes and how what their mode split is. But again, just be mindful of those statistics can't quite be taken with the margins of errors, and there's in those lower utilizations. So just be mindful when you're making those comparisons in the ACS data.
Perfect. Another question that we received in the chat was, does taxi include Uber and Lyft and other similar car services?
Yes, so the trips that I referenced in the maps, those are made by passengers in a taxi or using a transportation network company, as it's known, a TNC, such as Uber or Lyft, like a ride-hailing service. Yes. And thank you, Councilmember Keene, for your support in answering that question.
Awesome. Also, there is another question that we received in the chat, wondering about regional public transit through and to Rochester, if there are plans or conversations about that. So not just Rochester, regional transportation.
Matt, do you want to start with that
I
or?
can start. Yep, can do. So there is a convening of groups that are interested in providing transportation options to its stakeholders, whether that be its patients, its staff, its visitors, its students. So there is a convening of groups already that the city leads, and one of the groups involved is a transportation management organization, TMO feasibility study that was started by a Southeast Minnesota Together initiative that is looking at coordinating the regional transit services so that there is connection to various services getting to and from activity centers in the region. And I'm saying Southeast of Minnesota.
Great.
And
Thank
then we
you.
also have
Go
ROCOG,
ahead. Go ahead, Lauren.
which is the Rochester Olmsted Council of Governments, and they have more of a regional approach and look at least countywide, and like the broader Rochester metropolitan area. There is a long-range transportation plan and some recent surveys that have been out to gather input on updates to that related to trails and other types of transportation access as well. So yeah, collectively is a group of us and local partners trying to identify how we can collaborate on that as well.
Okay. And then I want to invite others. I've seen some members who open their camera if they have questions. You can definitely use like raising your hand feature. Or Al, I see you waving.
Uh,
Welcome.
I guess I have a question in terms of a driverless car or transportation driverless. Is there any thought about what that implication is down the road, like you that type of thing? And
There are certainly organizations studying it, Al. I was on a webinar just the other week that was talked about. There's probably not ever going to be the achievement of 100% complete driverless cars ever, but perhaps a greater share will be adopted in years to come. And if transportation systems are not planning for that, we might have be forced to rebuild in the future. So that's something that is on the minds of designers now. Um, what I also heard was that driverless cars are better drivers than a human being a lot of the time. However, there are going to be instances where they're still figuring out the technology to make it absolutely safe for people outside of the car too. So that's what we hear is the biggest concern in the active transportation plan that the city of Rochester has is separation from motor vehicle traffic. At the time, I don't think it was delineated that some motor vehicle traffic would be automated versus a human being operating the vehicle, but still we heard that consistently that the desire was to be separated from motor vehicle traffic. So I didn't give a comprehensive answer, Al, but I gave you a little bit of context from what I've heard recently.
I guess it's somewhat related. A while ago, there was some demonstration about the shuttle being a driverless shuttle. And then there was demonstrated by, I think the IBM folks had demonstrated something. I don't know if you know, what happened to that effort or there's any, like even the shuttle itself, maybe even the link transit may sometime later using driverless transit system. So
I can assure you that our city teammates will be learning more at the MnDOT convening in 2 weeks about automated vehicle operation.
But there was a driverless shuttle in Rochester that was a MnDOT pilot to see how it would work across all 4 seasons. So for a year there was one in Rochester. And maybe I'll just share like there are other great examples. Grand Rapids, Minnesota has a driverless vehicle that is almost like an Uber and a Lyft in a sense that they have an app, you can call it, and it helps bring people around and move people around in that community. So, a cool localish example of how it's being applied elsewhere.
thank you.
Thank you, Al, for your question. I see a comment from Patrick. Driveless Ubers how do you pronounce that?
Waymo.
Waymo? Waymo will be operating in the Twin Cities later this year. It was an interesting experience seeing those in San Francisco. So, Lisa, go ahead. You have your hand up.
Hi there. Good afternoon, everybody. I may have missed it, but I wanted to just double check. Being that we're the Med City, we have a lot of medical transportation companies that haul a lot of patients.
You went on
You're
mute.
on mute now. So go ahead, unmute yourself.
Sorry, I don't know why that just happened. I apologize.
It's okay.
I was wondering if, with your numbers and so forth, since we're the Med City, we have a lot of medical transportation companies that haul a lot of people around. that are in wheelchairs or not in wheelchairs. Do those numbers that you have with taxis and Ubers and so forth reflect those as well, or is that in a different category?
I'm thinking back on the data we had, and it wasn't delineated by, it was delineated by trip purpose, but I can't remember if the medical might have been different. So I don't have that answer right off the top of my head, Lisa, but if you'd be willing, I'm going to share my contact and I'd love to respond to you later, and I'll probably be able to get your information from Wafa or Chow, if I may, or you can send me a
Certainly.
note, but I can follow
Certainly,
up.
of course. I'll put my email in the chat as well.
Got it. Thank you.
Thanks.
So I do have a question that I have received also. Um, so if you were to summarize, what are some of the policies that could help this work and make better environmental changes and more equitable changes? What are some of the policies that we should consider in Rochester?
So the policies that exist in Rochester, we already have a unified development code that defines what a developer must what they're required to provide in their development. So we have standards for access routes for pedestrian access to main entrances. We have standards for providing bicycle parking, for making connections to nearby active transportation facilities. So that is one code that already exists, and it can be improved upon to help there be more integration or yeah, integration, I guess, with the public investment of the facilities being provided, whether that's through transit, like providing a stop that's also in the Unified Development Code, but also uh, active transportation facilities for end of trip facilities like racks, showers, benches for respite, shaded areas, covered areas to be protected from the elements, those types of things. And then there are other communities that have explored ordinances for transportation demand management. Other communities have also looked at like developing a menu of options for what developers can choose and determining a point value system to actually have requirements for what a developer must build to. Um, those are policies that can be explored with FA, and that's how I can respond to that question at this stage.
And maybe I'll just add, like, in addition to policies, we're also working on what are programs and pilots we can try here in Rochester. So, working with local partners to explore, there are a lot of things we used to have in Rochester that COVID impacted, like a bike share program or a car share program, or an app that people could use that incentivized people to try alternative modes of transportation. And I think being, many years out of COVID now and new partners that have come to the table that we're working with more intentionally, I think there are options to revisit those things and bring those back. So exploring the types of programs that could support these alternative transportation choices for people as well.
Thank you, Lauren. Thank you, Matt. I'm going to copy that QR code again and place it in the chat one more time for everyone. And if you can briefly say, where does this QR code take us and more information about the survey?
Sure. It'll take you to a survey. It's maybe like 5 questions. If you are with an organization, either, as a decision maker or an employee and want to explore what transportation demand management could look like, this is just to gauge interest in that. So it helps us know who we might follow up with, to help understand what you view as maybe the barriers to your workforce or your visitors or your customers, and how we can connect on that. So, like, again, we are, Matt's fairly new to the city. We're really in the beginning phases of implementation for this work and what it looks like. And so, just hoping to understand needs from different community groups and stakeholders, and where are our collaboration opportunities for that.
Then any other questions from the audience, from everyone who's here, or comments that you all would like to share?
Hey, Wafa, it's Brian here, Rochester Public Schools Community Ed. I was just going to
Hello.
write a note, but I think this is a huge conversation and involves way, way more than just not just, but way more than transit and what it looks like. I mean, we have to have access to affordable housing to access those transit routes. Where are they going to be? We could, again, if we're talking about increased population, where are they going to go? Because we create these um, sprawls where there's no infrastructure, there's no neighborhood shopping, there's no grocery store. We create these kind of manufactured food deserts, so people have to go somewhere to access and get their groceries. So there's a, again, what are the deterrents? And there have to be deterrents as well to change mindsets. So if you're going to create a vibrant downtown that's not only just for medical access, but for community access, youth, entertainment, all those kind of things, then how do you stop your traffic coming into that space where you don't want it? So pedestrianization, you know, keeping cars on the outskirts, or as London and some of the big cities in Europe have done, you want to come in, there's a tax. You pay a fee if you want to come into town. As DMC and Mayo is demolishing parking ramps, then what are those spaces going to look like? And then how do we feed those facilities with the people who need to access them? Where are they going to park? So again, it's a huge conversation, involves major, major mind shifts, infrastructure changes, affordable housing. Yes, and again, if you're talking about different modes of transport, then what does that look like on the roads? So do you give priorities to your transit so that you have bus lanes that are just bus lanes and cars aren't allowed in? You give priority to bike lanes. So again, you've got to kind of think big and long and hard about how you make those shifts and communicate that to people who are used to driving everywhere all the time. Anyway,
Maybe
that's my thought.
just to comment, I think we're really on the cusp of those shifts. We have a West Transit Village that's being developed in coordination with a bus rapid transit line. So that will be the first bus rapid transit line outside of the metro area. And we're excited to have that online and what that's going to look like. The city has developed park and rides north of Rochester. There's a new one that will be just more north on Broadway a little bit more, to really, how do we get this park once mentality and get people parking outside of downtown, and then using these transportation systems to get in and out of downtown, creating the affordable housing, and the alternative options like a car share or a bike share. So someone could live downtown and not feel like they have to own a car because they can walk to work and they have access to a car they can rent for the weekend or something like that. So I think we're just beginning. We've been planning for the last 5, 8 years, and we're kind of in this exciting phase of the development and the cusp of some of these projects and things coming together. So, but yes, the behavior change still has to come along with that, and getting people excited about these other options.
Thank you, Brian, for your question. I want to thank you, Lauren and Matt, so much for your presentation and spending time with us today in the equity series. And as we promised, we will send the presentation to you all in an email along with the survey. I want to encourage everyone to fill out the survey and also share it with your colleagues at your organizations. Just before we end our episode today, this is our monthly reminder that they are amazing other events that they're happening in Rochester, around equity, and hopefully you're all tuned in to Amanda from Rochester Area Foundation's group on LinkedIn, on Facebook, where she shares all the upcoming events, and she also sends the information in the email. And then finally, we will see you all next month, and it's our May episode is going to be on the 13th. We look forward to seeing you all with a new topic, a new presenter. Thank you so much for being with us today, and you have a great day.